Good.
Any questions? Good. So we're gonna do some more demos of adjustments. We'll work through thoracics and lumbar. We'll do feet. We got a couple of elbows that need to be adjusted. But before we do that, I really want to teach you this thing. You might already know it, but it's called a wall angel, and it's integral to my care planning with patients because, like I shared earlier, is that words have power based on who speaks them. And so when someone's looking for a chiropractor, they really are looking for someone that they can look up to when it comes to their health. And so one of the things that really hit me, I was in a seminar not too long ago. It was probably about 4 or 5 years ago. And they were teaching functional movements, and we were talking a lot about posture and technique in particular. And the man came up and he demonstrated this thing called a wall angel. Anybody ever heard of a wall angel? A few people. So this is a movement that is that you can do that really takes about 60 seconds to do. That will dramatically improve your spinal health. And it's in our day 2, we do a posture assessment on day 1. After I explain that whole neurologic reflex, dural torque, fight or flight thing and bring them out of it, I let them know I want to see them in a week, check their structure, and then from there, I leave with this. We're also going to go over your posture together, and I might have a couple of simple things that you can do on your own in between your adjustments that will help your spine and your overall health. And they go, sounds good. So then I have something that they're wanting to come back for to look at. And I know a lot of people might, how many of you do x-ray in your office? Yeah, and that's pretty typical of when I ask that question now. We do have x-rays not in the office. We use an imaging center. We get a radiologist report with it. When we need to send an x-ray, they have digital. It comes to us. We can order an x-ray for like $50. And it doesn't matter how many views. If I want to have a cervical spine x-ray done, I can get a whole Davis series for the same amount as a 3-view, right? And then the radiologist reads it, which is great, and I put my eyes on it. So we don't have to use the square footage in our office to have x-ray. I think x-ray is an incredible tool. We usually use it if there's this incidence of trauma in the history. But we do posture, and we use the Posture Screen mobile app. I think it's an incredible tool generated by chiropractors. I think they're out of New Jersey. And we've been using it for about 8 or 9 years. So we have these trend analysis that we can show a patient every 12 visits how their posture is changing. And then we can give them new exercises in addition to their adjustments that they can do at home. The biggest thing that I found in my experience is that it has to be something simple for them to do. It cannot be difficult. Who has time? And how many of you have time to stretch for like 30 minutes a day in addition to your regular workouts and all your life demands, right? So when a patient comes back in, we'll check that same thing. We'll check their dural torque again. And then we'll adjust everything that needs to be adjusted. We'll talk about a frequency for them to get adjusted. Hands down, at least 8 out of the 10 patients that come in my office, they have already been through a corrective care plan with another chiropractor. They've already done some kind of extensive 3 times a week for 6 weeks, that normal type of corrective care plan, 8 out of 10. And I'm in San Diego, so there's a chiropractor on every block. And so then they really want to get adjusted. They could tell it's a benefit for them, but for whatever reason, they didn't go from the corrective care model with that one practice into their wellness model and stick to it. And this is the truth with any kind of when we take our healer hat off and put on our business hat as chiropractors, retention is the holy grail of any business. So if you can figure out how to retain and keep an existing client happy, that is so much easier than attracting new clients in the door. And we can talk more about that probably at the break because it's not like a business management. So if you have questions on that, you can come let me know. The last thing I'll say on that is you can convert chiropractic people to chiropractic as chiropractic patients in 2 ways. One is that you can bring them in and teach them and get them familiar with your flavor of chiropractic, your style and your vibe, if you will, of your methodology of practice. Or you can actually have them already gone to a chiropractor, and that chiropractor maybe is retiring or moving out of state, and then you can have them come in based on the goodwill of the recommendation of that doctor. So you can kind of convert them from scratch. And how many of you were chiropractic patients before you became chiropractor? Most of the room. And that's really true for chiropractic. I think it's one of the best things about our profession is that we actually felt called to become a chiropractor because of the experience that we had in a doctor's office. And because of that, there's actually this conversion that happens, and it happened for me, and it was one of the biggest parts of my healing, as I shared with you earlier in that story, is that for the first time in my life, I felt hope in a doctor's office, and then I had a transition very rapidly in my life to where the locus of control of my health came back to me and not to outside sources. So I could no longer blame my lack of thriving and health on this incident that happened to me with the baseball, right? I actually moved into like, what can I control? And what I found out was that when I changed my diet and I stopped eating inflammatory things that I didn't know I had food sensitivities to, I had a reduction of inflammation in my face, right? When I started exercising and I did a lot of positive thinking, then all of a sudden my health began to thrive again, right? And I was getting adjusted all the way. Isn't that a cool thing? So with that shift that a patient has from kind of outside in thinking when it comes to their health to the chiropractic model of inside, above, down, inside out, right? There's a full conversion process that happens. So you can convert them one by one over here, or you can find a doctor that wants to retire and you can have them come in, and all you have to convert them is to your style of practice. And that's what I've done, and that's why we've exploded with our patient outcomes, which is a code word for, doing really well in chiropractic business. So with that being said, when we do a wall angel, so I'll do it on this wall. So what I'll share with the person is we'll have their posture printed out, right? And we'll show them their posture. And I think one of the most powerful things you can do is you can just show it to someone and say, what do you see here? And just let them tell you what's on it. And they go, well, I'm leaning to the right, and I'm the red line, and that green line looks like it's straight, and I'm not straight. And you're like, yeah. And then they go, okay, what about this view? Well, my head is way forward. And then you flip back to the front page, and it actually gives effective head weight. So for every inch forward for the head, it increases by about 10 pounds. Sometimes it doubles the head weight, the effective head weight on the shoulders. And I'm 39 years old, so I was 8 years old when Nintendo came out. And then you can see the explosion of what's happening with kids. This is an epidemic. Like we think we have, like, this is a problem now. Imagine, we have 4 children, they're 11, 9, 6, and 4 years old. Imagine if from birth you've had a thing that is so engaging and you have to do this to look at it. Imagine what those kids are gonna feel when they're 20, 25, 35. We're already seeing it. So what I tell kids is I'll say, there's nothing down there for you, everything's up there, right? And then I'll also share with them that if you have a phone, iPhone should be eye level, these little things. And I'll educate the parents because I have 4 children, so I have no delusions of what it means when I can give my kid a phone and my wife and I can have an adult conversation for like 30 seconds, in real life. And I tell, my dad's great about it, but I see parents shame their 30-something-year-old kids because they're giving the kid an iPad or something. I'm like, don't get it confused. If you had that thing when we were kids, you would have had us on it 24/7 because I know what I was like, So with that being said, iPhone eye level, and I'll tell a parent, I'll say, look, you're in charge, you are the authority in your household. So what if your child could only play on the phone or the tablet when they lay on their stomach? Because what happens when they do that? Well, they go into extension and they have to kind of be on their elbows. So it's the difference between this, right? I'm exaggerating, but you know what it is. And children are so flexible. They're like this, they look down at it. And then compare that to this. If I'm a kid and I want to look at it, and you know how kids are, they don't feel pain the same way we do, so they'll stay here for 30 minutes if you let them. But eventually they're gonna get kind of uncomfortable. And then the second that they do that and they get up, well, that's a good time to take a break from the device. And then if they want it again, and you're okay with it, you lay on your stomach. That's what we teach our kids. So my kids, when they do play on a tablet or they're looking at something on their phone, they have to lay on their stomach. And I'll catch them on the couch and they'll be looking at it, I'll be like, lay on your stomach, and then they'll do it because they know I'm going to take the phone away if they don't. Right? It's a really good tool for your parents to have young kids, because you don't want them to be doing this for 15 years. It's going to be really bad. So after that first visit, what we'll end up doing is we'll adjust them again. We'll get an agreement on frequency, and then I'll show them a wall angel based on their posture. So I think this is the best place to do it. So your feet are shoulder width apart, about 6 inches off the wall. And then you have to do a pelvic tilt to get your lower back flat on the wall. And that's the most important part of the exercise, is that they have to hold that pelvic tilt. So as they hold the pelvic tilt with their lower back touching the wall, it can't come off the wall, and they bring their arms up like this. And then they're gonna move their arms up until their elbows are totally locked, right? And then come down. It's about a cadence of 5. 1, 2, 3, 4, 5 up, 1, 2, 3, 4, 5 down. So when I first started doing this, I couldn't do it. I got stuck. And that's when I was like, holy cow, because it looked so simple. And I couldn't do it. So I had to go like this for months and months. I was trying to stay more on the wall, but I couldn't do it. And I had to get my elbows totally locked. My lower back is still touching the wall, my head's on the wall. I'm even trying to get my neck flat on the wall, if you will, right? And after doing it for months, and this is exactly what I tell the patients, we're gonna find your starting place, but eventually it should look like this. So as you go up, your elbows lock all the way, and then you come back down and squeeze your shoulder blades together. And then you go back up, and your elbows lock, and then you come back down and squeeze your shoulder blades together. Now I can stay on the wall almost all the way, but I have to come off a little bit at the end to get that last little bit, and then I come back to the wall like that. And it's gonna feel like you're working out your back like crazy, but it shouldn't hurt. It shouldn't feel like a big stretch. So then I'll say, do you wanna try it? And inevitably they do. And then they get on there, and guess what happens? They go, oh, this is really hard, because it looks really easy. Who wants to try it? Anybody?
Yeah, I'll try.
Yeah, great to see you. Thanks. So then I'll coach them through this. And 1 second, this is really big, because once the ego is really powerful, and if I go and I want to pay someone for their expertise, like in my subconsciously, I gotta go like, well, what do they know more than what I know? Maybe that's because I got an ego, I don't know. But I want to know why I should listen to them. Once I do something that they are not able to do, then they go, wow, like I want to be like you. That's the highest form of leadership, is where I want to be like you, right? So go ahead and try. So you're going to tuck your hips right here so that your lower back stays on the wall. That's the most important thing. Don't lose that. So I can't get my hand behind him here, right? And then don't lose that no matter what you do. Now you're going to go up to the ceiling. Yeah, and you're doing great, but I'm going to modify you, because the second most important thing is that you get your elbows totally locked down. So I want you to come forward as much as you need to so that you can finish with your elbows. Yeah, totally locked out like that. And then don't lose this. You lost that, right?
Yes, I did.
Yeah, so hold that. And bring this even more forward. This is how, and then I'll normalize it for them. It's really important. I'll say, this is how I was when I started. I'm with you, right? Because it's true. So then you're just like I was when I first started. So elbows totally locked. Now when you come back down, you're gonna bring your elbows kind of down into the wall, but breathe and don't pass out on me, right? And don't lose this though. There you go. Great, so that's a good starting place for you. So do a few like that. 1, 2, 3, 4, 5 up. Shouldn't hurt, right? Just a big stretch. If it hurts, you need to bring your arms even lower, okay? And then back into the wall. You're doing perfect. So I'll tell them, you're doing a great job. He already knows I did it better than him. It's not about that. But now he's gonna follow me a little bit better. Like, it's natural. It's really big, right? And I build a huge amount of credibility by doing that. And all I had to do was do this every morning and night, and within 3 months, I started just like that. It's crazy to think, right? So you're doing great. Now do like 2 more, and then I'm gonna show you something cool. And this is the kicker, because once he gets off of that wall, he's gonna feel something that he's never felt probably before in his life. Because this isn't a body exercise, it's a total neurologic brain exercise. He has to think about all these things in space and doing it just right. Now watch Steve, just come off and stand up normal. Now just stand. You feel that?
Yeah, it's a lot lighter, it's,
And
it feels perfect.
isn't that cool?
It is.
And so then I'll tell them, like, here's the thing. We can stand at attention and we can all change our posture. But the second I relax, I'm gonna go to my default posture. What this does is it neurologically turns on the extensor muscles of the spine to create a new normal posture without thinking about it. So anytime I was told I should have sit up straight, I should have been told to do wall angel. And that's what I tell my kids to do, right? And that's what they're gonna tell their kids. Isn't that cool?
Yeah.
Yeah.
Very
Right
much.
on.
Appreciate
So I just
that.
do it every time I brush